I really wanted to understand how people were experiencing the pandemic and from the bureaucrats' perspective, how they were responding to major changes in social welfare programs. I'm Carolyn Barnes. I'm an associate professor at the Crown School of Social Work Policy and Practice at the University of Chicago. I'm a political scientist and I study how social welfare programs are designed, delivered, and experienced by people. During the pandemic, I had the opportunity to interview people who were delivering assistance programs and receiving them. And we often talked about how difficult it was to adjust to policy changes and the economic and health fallout of the COVID-19 pandemic. During my year here at Russell Sage, I'll be developing an analysis plan for that data. We collected over 450 interviews across 3 states, and we're hoping to use that data to understand how people experience the COVID-19 pandemic and to generate some policy recommendations on how we can improve safety net programs. So this year at Russell Sage, I'm taking the time to analyze all this great data we collected throughout the pandemic. We have about 450 interviews across 3 states, and we're really trying to understand experiences and challenges and the strengths of COVID-19 policy changes in efforts to generate some policy recommendations and make the safety net more of a safety net for vulnerable families. We hope from this project to generate some actionable policy recommendations. For example, we learned that applicants and beneficiaries appreciated greater flexibility in how they apply for and use programs. Options like remote over in-person interviews or food flexibilities for WIC. Our findings also highlight the need for grassroots information sharing about programs to encourage people to apply. Finally, our findings point to the need to invest in administrative funds for assistance programs. This kind of investment can help strengthen agencies' capacity to meet new and growing demands for benefits. The COVID-19 pandemic represented a watershed moment in social policy. The federal government removed a lot of barriers to accessing assistance programs, and we're going to try to use the data to make the case of why these changes should remain and how we should innovate to make the safety net more accessible to vulnerable families. This topic has personal significance for me because I grew up on welfare programs, and I realized that the safety net didn't help my family. We fell through the safety net. So I've been motivated for a very long time to understand why programs are designed the way they are and how we can make them better. So far, I've led a research team to produce a series of journal articles on this topic, how COVID-19 changed the safety net and how folks are experiencing welfare programs. But that was from one state. Here at Russell Sage, we're trying to understand variation across 3 states and how bureaucrats experience the COVID-19 pandemic and how vulnerable families attempting to access programs experienced the COVID-19 pandemic. So we want to generate a series of high-impact journal articles that can hopefully generate some policy recommendations to strengthen the safety net. I'm having so much fun here at Russell Sage. This really is a playground for deep thinkers across a range of disciplines and perspectives. I feel like I've gotten so much supportive feedback on my project, and it's only been, 2 months in, so I highly recommend this program to anyone.